Pancreatic cancer occurs when the cells that make it up undergo mutations in their genetic material, which leads them to divide and multiply uncontrollably. It is the cancer with the shortest survival, both 1 and 5 years after diagnosis, and the American Cancer Society estimates that 64,050 Americans will be diagnosed with pancreatic cancer in 2023. Only 7% of pancreatic cancers are diagnosed when they are still in their early stages, as they generally give symptoms only when they are already in an advanced stage. That is, when the tumor mass has reached larger dimensions, or worse still, has spread to other organs. In the last video, which you can find by clicking here above, we saw what some signs and symptoms of pancreatic cancer can be. The term risk factor indicates a characteristic, condition, or behavior that increases the probability of developing any form of cancer. There are 2 types of risk factors for the onset of cancer: non-modifiable ones, such as age, gender, and genes inherited from one's parents, and modifiable ones, linked, for example, to the behavior and lifestyle habits of the individual. In this video, we're going to see what are the modifiable risk factors of pancreatic cancer, and therefore what can be done to reduce the risk of developing the disease. Tobacco. Tobacco smoking is considered a risk factor for the development of at least 17 cancers, including pancreatic cancer. The lighting of a cigarette determines the combustion of tobacco, and therefore the production of over 7,000 chemical substances, of which at least 250 are known to be toxic and harmful, and of these at least 60 are notoriously carcinogenic. Cigarette smoking is responsible for the onset and progression of pancreatic ductal adenocarcinoma, the most common form of pancreatic cancer, accounting for about 85% of cases. This is because the chemical substances contained in the smoke alter the enzyme secretion, morphologically damage the ductal and acinar cells of the pancreas, induce high inflammatory states, and cause epigenetic alterations. Nicotine, a vegetable alkaloid particularly concentrated in tobacco leaves, promotes the activation of pancreatic stellate cells. These are cells whose extensions resemble the shape of a star, which are found in the exocrine regions of the pancreas and are typically dormant in normal tissue. The activation of pancreatic stellate cells affects the normal function of pancreatic cells and causes the secretion of proteins in the extracellular matrix, growth factors, and cytokines, all factors that play a fundamental role in the development of fibrosis. Furthermore, pancreatic stellate cells contribute to the pathogenesis of pancreatitis and pancreatic cancer as they modify the cellular microenvironment. Not only that, when they are activated, they alter the metabolism in pancreatic cancer cells and begin to secrete substances that have the task of stimulating tumor growth. This collaboration between cells allows the tumor mass to adapt effectively to environmental changes, favoring its growth and survival, as well as reducing the action of chemotherapy. However, further studies will be needed to identify more precisely the mechanism by which smoking causes the onset of pancreatic cancer. Tobacco smoking is the main proven environmental risk factor for the development of pancreatic cancer and is thought to be responsible for 20–35% of cases and nearly a quarter of all deaths from this malignant neoplasm. The risk depends on the duration and intensity of smoking, as well as the age at which smoking starts. Smokers have a double to 3 times the risk of getting sick compared to non-smokers. Chronic pancreatitis. Chronic pancreatitis is a progressive inflammatory disease leading to irreversible destruction of the pancreas, where pancreatic tissue is replaced by non-functioning, fibrous, scar tissue. Among the main causes of chronic pancreatitis, we find excessive alcohol consumption and cigarette smoking, capable of modifying various pancreatic functions, including preventing the activity of lithostathine. It is a protein produced by the acinar cells of the pancreas and secreted into the pancreatic juice to inhibit the precipitation of calcium carbonate, that is, prevent it from ending up in the pancreatic ducts to form stones, which could then block them. However, when the body comes into contact with some exogenous toxic substances, such as smoking and alcohol, the degradation of lymphocyte increases, and therefore calcium is free to deposit in the ducts and hinder the outflow of pancreatic juice, triggering an inflammatory state affecting the pancreas. The chronic inflammatory processes that characterize pancreatitis promote the accumulation of DNA damage and therefore of oncogenic mutations that favor the neoplastic transformation of the cells that make up the pancreas. Chronic pancreatitis, therefore, remains one of the major risk factors for the development of pancreatic cancer and increases the risk by about 10 times compared to the general population. Diabetes. Diabetes is a chronic disease characterized by the presence of high levels of glucose in the blood and is due to an altered amount or function of insulin, a protein hormone that is produced by the pancreas to keep blood sugar under control. In type 1 diabetes, the pancreas is unable to produce insulin, while in type 2 diabetes it is produced, but in small quantities, or the target organs, such as muscles, liver, and adipose tissue, do not respond adequately to this hormone. Epidemiological studies suggest that people with diabetes, especially type 2 diabetes, have a 1.5–2 times greater risk of developing pancreatic cancer than the general population. The biological mechanisms that determine this association are unclear, although it is plausible that cellular responses to high levels of sugar and insulin in the bloodstream are involved, as well as inflammation and insulin resistance. That is when cells of the body lose their sensitivity to the action of insulin. These are all possible causes that contribute to the development of pancreatic cancer associated with diabetes. According to experts, the association can also be attributed, at least in part, to the risk factors shared by the two diseases, such as aging, obesity, an unbalanced diet, and low physical activity. Diabetes and pancreatic cancer thus form a dangerous friendship, as diabetes can be both a risk factor for pancreatic cancer and a symptom of malignant neoplasm. However, this does not mean that all patients with diabetes will develop pancreatic cancer, but caution should be exercised in the case of new-onset diabetes or when it suddenly worsens. The Ministry of Health therefore recalls the importance of preventing, or in any case, reducing the severity of type 2 diabetes, trying to keep glycemic values as stable as possible over time. The rules that must be followed are to maintain a healthy weight, follow a healthy and balanced diet, perform regular physical activity, do not smoke, and reduce alcohol consumption, or better still, abstain completely. In the case of diabetic people, in addition to what has just been said, it is also important to always take the pharmacological therapy prescribed by the doctor and carry out glycemic self-monitoring in order to monitor the progress of the diabetes. On the other hand, the case of type 1 diabetes is different, which can hardly be prevented, as the risk factors that interact with the genetic predisposition, triggering the immune reaction, are still unclear. It is therefore an autoimmune disease, in which the immune system causes the destruction of those pancreatic cells that have the task of producing insulin, as it recognizes them as foreign and therefore dangerous to health. According to the Italian Association for Cancer Research, more than a third of cancer deaths in general could be avoided only by intervening on modifiable risk factors. Unfortunately, it is not possible to intervene on the non-modifiable factors, as the name suggests. In the case of pancreatic cancer, they are age, where it mainly affects people between 50 and 80 years of age. Inheritance, in which about 1 in 10 people with pancreatic cancer had one of the two parents with disease, and some genetic disorders, including a genetic mutation of the BRCA2 gene, which is also responsible for other forms of cancer, including breast cancer. The Italian Association for Cancer Research also reminds that the risk of developing cancer is always individual and is due to the combination of various genetic, environmental, behavioral, and causal factors.